Dr. Azari Marthaman is one of the many brave Canadians who volunteered their time to fight the terrifying outbreak of Ebola in West Africa. He's here to tell us all about the experience. Welcome.
Thank you.
Now, you were there with Samaritan's Purse, which is a Canadian charity that is still working in Liberia, which is the country you worked in. And you went twice, not just once.
That's correct. Yeah, I was there in July last summer, as well as in September, October.
Now, we can't take that lightly because, you know, maybe when you first went in July, I don't think any Western aid doctors had contracted Ebola, but by September, that was the case, was it not?
That's correct. We initially worked with the treatment units, and at that time there was no expat individual that had contracted Ebola yet. And it was really towards the end of July that Dr. Kent Brantley and Nancy Redwold were diagnosed with the Ebola.
So tell me about the kind of conversations you have when you make a decision like that, because obviously you have, you know, you're a person of faith, you have a heart to help people, and that's part of your decision, but you had to be realistic as well as a medical professional to say, it could happen. Like, you know, it's not 100% sure that I'm not going to get Ebola.
Yes, it's a personal journey, a change of the heart, you know, because it's a process that I go through. The first time I was involved with disaster response was in 2010 with the cholera outbreak in Haiti. And remembering at that time I was in my office, and then one of my colleagues came and said, "Hey, did you see that email that was sent out asking for doctors to go and help out with the cholera outbreak?" And, you know, being busy before Christmas and so on, didn't really think much about it. So, but later on in the day, it was almost like God spoke to my heart. Why not? Why not go? And so the story of the Good Samaritan really kind of fits the model of what I go by, because, you know, even the organization Samaritan's Purse, that is really what is at the heart of why we do what we do, is that there's a need, somebody who is hurting, and taking the time to do something. And in Proverbs 3:27, it says, "Do not withhold from doing good to those it is due, when it is in your power to act." So that verse really came to my mind. And this particular outbreak with Ebola in West Africa was that much more heightened in its risk towards me personally. And so as a family man, for me, I would not go if I did not have the blessing of my wife and my children, as well as the very close friends, my business partners and so on in my community. So in that, it was really a soul-searching time. The idea of being willing to go and perhaps contract a deadly disease like Ebola was not an easy thing, but ultimately it's trusting what God can do and what is in His sovereign plan.
And here in the West, we don't have to think about facing death for our faith, whether through persecution or generally we haven't had an outbreak of something like Ebola, you know, and especially not because we chose to put ourselves in harm's way. So I think those are such important things to have. And I know, you know, you made that commitment, you counted the cost, you showed up there, and then you had to, you know, face not only people dying almost every day, but you had to suit up where you couldn't even really interact with them, your eyes just through that suit. Tell me what that experience was like, because I know it was hard to get used to even being in that suit.
Yeah, it's very difficult because it's really, really hot in that suit, you know, and each time I would come out of the suit, I would be drenched from head to toe, literally, you know, whether it's only 15 minutes or 20 minutes. But, you know, we had a limit of at least the length of time that ideally we should not be in there for like 45 minutes to an hour. But the practicality is that we are often in the suit longer just because of the need as we are triaging patients and so on. And so we do the best we can, and we help each other to keep each other safe. But, you know, the first time I was going into the PPE, the personal protective equipment, it was actually Nancy Redwold who taught me that. So here she was, this awesome lady who is a long-term missionary, she and her husband, and she was just willing, you know, she didn't go for an Ebola battle when she first started into the mission field, but she was there, she was already a missionary, and so Ebola came and she just jumped right in and helped out. So I learned from her because I had a crash course to need to be able to do this. But the first time I put the PPE on was quite an experience because it was very difficult to breathe through that mask, and very claustrophobic feeling. And you know, I equate that to my experience in the past when I was in I was in the military, in the Canadian military, and so I had experience with being in the F-18 fighter pilot, the fighter planes, and so being in the suit, the G suit plus the pressurized mask and so on. The experience of being in the PPE is so much more restrictive, so much more difficult, and the heat and being just in that environment.
Yeah.
And the sad thing about this is that I'm so used to being able to communicate by the touch and the feel of things, you know, with my hands, and to see face to face and the expressions of the eyes and that whole aspect of interaction with my patients. While when you're inside this PPE, you're an unknown. It's just all that is showing are your eyes. So I do the best I can with the tone of voice and still do the best I can to touch patients in a way and to pray with them. So that personal side of our patient care, a lot of that has been restricted just because of this protective equipment. And on one occasion, I had my heart was racing fast when I realized there was this fluid sloshing inside my gloves, and just thought, oh, is there a compromise that my gloves,
Yeah.
is there a break somewhere, you know? And then it dawned that oh, this is actually my own perspiration inside of my equipment
Yeah.
that is doing this whole
Terrifying.
thing.
And I know that you got really dehydrated as well, but we just need to move on because we're running out of time. But I wanted to ask you, because I think one of the hardest things is, you know, that you're caring for these patients, you have such a heart for them, but some of them are just not making it. And kids, of course, are the most vulnerable. How did you process that part of it?
Well, it's a sense of trusting in God's sovereignty, because it is really sad to see families die out one by one, and sometimes entire families are wiped out.
Wow.
And then to see children, the vulnerable ones are the children, they get dehydrated very, very quickly and they die. And so to see the isolation that happens with our patients, so it's a terrible disease to die from, because in other diseases, at least your family can be there to be with you. But in this particular situation with Ebola, when you come down with Ebola, you're dying alone. So from the nursing or the physician side of care, we do the best we can to meet their emotional, psychological needs. And most of all, there's lots of questions that are asked by these people. And so we provide that spiritual counsel and advice as well, which is, I think, working with Samaritan Express gives me that ability to do that, which was a blessing.
That spiritual comfort is so needed. And I know, too, the signs of hope are the things that keep you going. You had met a little boy your very first day in Liberia, the very first trip, William, who didn't look like he was going to make it, right? What was he, 11 years old?
Yeah, he just basically was in such a terrible state, very well, you know, dehydrated, and we didn't think he was going to make the night. But he managed to actually survive, and I was able to see him when he was coming out of the hospital.
And I think that's God's gift. It was your last day in Liberia, you were leaving, and who do you see right there, healthy, clear of Ebola, is William.
Yes, yeah, to see the cycle from the start to the completion was a really joyous occasion, and so that was a wonderful blessing in that part of it.
I think when we hear about all the death, we forget that there are people actually who are saved and do survive, and they have a much better rate of survival when they have that medical care. Because even though there's no cure, you can help them with rehydration and, you know, other therapies to help their bodies fight.
Yeah, and that makes a difference, because, you know, going to a place where the death rate was about 90% with the previous statistics. But when we were able to implement resuscitative measures such as IV fluids and good nursing care and appropriate management with comorbidities such as concurrent malaria, then the survival is much, much better. And so we were able to save quite a lot of people, and we did actually make a difference.
I've been in hospitals in Africa, so I understand that the capacity just for normal emergencies, even childbirth in many of these countries, isn't there. So I can't even imagine. We need to keep praying and funding work in Africa. Thank you so much for all that you've done. We really appreciate people like you who are going there to help make a difference and save lives at your own personal risk. I think that's truly what people of faith, you know, what we do in the world.
Well, thank you.